Alright, so hold on. So I'm kind of continuing from the last video I kind of did. Just a little reading, you know. So I'm just, you know, I said, well, I read the other part. Let me go back and read a little bit of this part. Some more I talked about how we were going to talk about the nervous system and information reflex zone. So blah, 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 blah. Da, 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 da. Anyway, I'm just going to start right here. So normally, this, you know, based talking about the, remember about the formation of the reflex zones, the result of the chronic disorder, visual disorder. So this basically is talking about like each part of it. So it's more the phenomenon with the hyperirritability that we're going to talk about. You know why these issues start to happen. You know why. You know, so you got a stomach issue. You know, it can have a reflex on the skin, the connective tissue, the skeletal muscle, and the periosteum. You know, so this is more the hyperirritability part. We're not going to talk about the first two paragraphs, but anyway, we'll start right here. Normally, the threshold of the peripheral receptors have a stable electrical magnitude. However, constant radiation of motor impulses to the skin, if you remember this other part that we talked about, the skin, the fascia, the muscle, the periosteum within the areas of the reflex zone evokes unusual phenomena, pneumonia, phenomenon of the tissues. The magnitude, I don't know why I thought that. The magnitude of the thresholds is reduced in all receptors in the located areas. As a result, the receptors start to generate action potentials as a response to even the weakest stimulus, which normally would have sub-threshold level and would never have produced a full action potential. This phenomenon is called hyperirritability. You know, like a lot of trigger points. Like I said, like if I touch you, like in certain parts of your arm, like ow, that hurt. Such things like that. So that's your hyperirritability. The constant activation of the peripheral receptors by sub-threshold stimuli evokes unnecessary sensory information, which is sent to the CNS. The CNS immediately responds with motor commands to the affected organ and to the reflex zones. We pretty much talked about that earlier in the last section. So go back and re-listen to me talk about that. As a result, the soft tissues build up in tension. So we're talking about like the stomach. Okay, so it might be reflected to like the muscle, like the stomach. I say the stomach, it might left part of my chest in that area right there. So as a result, the soft tissue builds up in tension, especially in the contractile elements, followed by vasoconstriction. Remember, vasoconstriction is vaso means vascular, constriction of blood vessels. You know, so without receiving no blood, no oxygen, either to the stomach or to certain parts of the muscle, or to certain parts of the skin or the fascia, and local edema. You know, we all know what edema is, because you know, like a lot of people have edema, especially like you see a lot of pregnant women with edema in their legs, and they start creating a lot of edema, which is not natural either. But we could talk about that later. I have a whole bunch of information on that also. This further diminishes blood circulation and decreases tissue metabolism, with subsequent changes in the local pH. Figure F12 shows how the action potentials are generated in the normal parts and in the areas of the reflex zones. Every practitioner who works with the soft tissues uses the phenomenon of hyperirritability on a daily basis. You know how like you go to massage therapist or chiropractor or PT and they touch you in some area, you just be ow, that hurt. When he or she examines skeletal muscles to find active or sleeping trigger points, the practitioner uses the so-called jump symptom. In such cases, the application of moderate pressure in the area of the trigger point in the muscle produces the facial expression of discomfort, or the patient withdraws part or even the entire body. At the same time, the application of the similar pressure on the unaffected muscle tissues does not cause any signs of discomfort. This jump symptom is a pure condition of hyperirritability of the pain receptors. The threshold of their activation in the area of the trigger points drop to a critical degree when even moderate pressure in the soft tissue stimulates pain receptors, which is seen as a jump symptom. Okay, so the last few paragraphs, it gets a whole lot better. So that was just, blah, blah, blah. It gets a little bit better so I can start to understand, and you be like, oh, okay, I see what they're talking about now. Especially when we go back and listen to like the first video. The decrease in the peripheral receptors threshold, there's the condition of hyperirritability, is a starting point of the reflex formation. In 1947, a series of brilliant clinical experiments, Professor Core showed that the condition of hyperirritability is the key to understanding the mechanism of reflex formation. In 1947, a series of brilliant clinical experiments, Professor Core showed that the conditions of hyperirritability is the key to understanding the mechanisms of. What am I at? I kind of look off the page. Where am I at? The mechanism of reflex zones formation. The author inserted microelectrodes into the muscles that exhibited clinical symptoms of hypertonic abnormalities and exposed subjects to different types of stimulation, whether it's physical activity, decreased and increased temperatures, whether hot and cold, loud sounds, music, bright light, sun, things of that nature. When the subjects were exposed to each of these stimuli, even visual sound, the electromyography registered immediate increase in tension in the affected skeletal muscles. So it caused an additional decrease in peripheral circulation, movement of vasoconstriction in the already affected areas. So that's even worse. So let's say you got tight muscles, you want to cook or just move your arm, it's going to hurt. You ain't going to be able to move because it's already been overstimulated. So it needs to rest and to get the minerals, get the nutrition to it. It needs to just rest. Thus, as Professor Core showed, any type of sensory stimulation of the CNS supports any further development of reflex zones in the soft tissues, which are no longer protected from the activation of the peripheral receptors by subthresholds. So we're going to read that again. Thus, as Professor Core showed, any type of sensory stimulation of the CNS supports the further development of the reflex zones in the soft tissues, which are no longer protected from the activation of the peripheral receptors by these subthreshold stimuli. The works of Professor Core perfectly explains why the patient with severe low back pain. Professor Core perfectly explained why the patient with severe low back pain intention initially had these symptoms after doing a very simple and harmless moves. Bending to put on shoes in the morning. I talked about that. People waking up with stiff and they just stiff all over the town. And that's not normal. Getting in the car. Nature did not design the human body in a way that such movements, stress, or changes in surroundings temperature would trigger muscular spasms and pain. In such cases, we are dealing with the condition of hyperirritability of muscle spindle receptors. This condition slowly. I'm also talking about how something slowly develops over a period of time. Like it's just slowly develop. People think that they get old because they get a certain age. No, God ain't credits like that. It make no sense for credits like that. Until the body is not able to compensate for the somatic abnormality, and even a simple factor became the last drop before the cup overflowed. That's crazy. Nature did not design the human body in a way that such simple movements, stress, or changes in the surrounding temperatures would trigger muscular spasms and pain. In such cases, we are dealing with the conditions of hyperirritability of the muscle spindles. The muscle spindle receptors. This condition slowly develops over a period of time until the body is not able to compensate for the somatic abnormality, and even a simple factor became the last drop before the cup overflow. You know how all I did was I just bent over and I tied my shoe, my back blew out. Hey, you got to get back to nature. I keep telling y'all, man. I've been telling y'all for years. Anyway, at this moment, an additional sudden decrease of the threshold of the muscle spindle receptors create a massive, alarming flow of sensory impulses to the corresponding segment of the spinal cord, with the following activation of the lower motor centers in the anterior horns and massive motor output to the same muscles. This motor output from motor centers in the anterior horns and massive motor output to the same muscles. This motor output from the motor This motor output from the CNS has one goal: to protect the area. This motor output has one goal: that's to protect the area where excessive sensory stimulations originated by blocking any muscular contraction. Clinically, it shows as a muscular spasm, pain, restriction, range of movement. That's lots of, I'm always talking about this stuff, man. We just got to just get back and, man, just let the whole entire body relax, man. Take a break, man. Stop eating so much. Stop eating 30, 40 times a day when you got all these problems, man. Eat once or twice, and some days don't even eat, man. Just let your whole body just relax, and you'll start to see how all those pains will easily start to go away. From the medical massage therapy point of view, the phenomenon of hyperirritability has a great practical value because the restoration of the normal threshold peripheral receptors, especially pain receptors, is the first critical step in any rehabilitation of the soft tissue. You don't want to go to. I don't want to say you don't want to go, but we'll leave it at that. The peripheral nerves. Without the elimination of this condition of the hyperirritability, the results of therapy will be questionable, very questionable. But anyway, I just wanted to read that to y'all. So y'all fellas be easy. I'm out, and y'all have a good one.